Okay, Ashley, you're rolling. Very good. I'm Joe Calderoni from Mount Sinai, South Nassau, and welcome to today's briefing and panel discussion about Mount Sinai, South Nassau's latest Truth in Medicine poll. This is actually our 23rd Truth in Medicine poll. We started these in 2017. They're funded by our good friends at Four Leaf Credit Union. We wouldn't be able to do these without their support. The purpose of the poll is very simple. We gauge the public's knowledge on pressing and topical public health issues, and we use that information to try to advance our relationship and knowledge with patients. Today's panel is going to include Dr. Rob Sharma, president of Mount Sinai South Nassau, Dr. Aaron Glatt, the chairman of our Department of Medicine, and we hope that we're going to be joined by Dr. Lawrence Canner, who is the chair of the Department of Cardiology here at Mount Sinai South Nassau. He is seeing patients, so he said if he's able to get down, he's going to join us. So today, we hope that Santa Claus is listening because the wearable devices are very popular. As we all know, one of the poll findings indicated that nearly half of all those who responded to the poll do use some kind of wearable device. And the topic also explored how the data is used. People who use the wearable devices obviously collect a tremendous amount of health-related data. And we also asked about how that data collection and their use of these devices impacts their relationship with their healthcare providers. So Dana Sanneman, my colleague, is going to take us through the poll findings.
Thank you. So as Joe mentioned, this is our 23rd public health poll. We started in January of 2017. The poll is done via a independent poll company, LJR Custom Strategies. So between November 12th and November 16th, they polled 600 adults via landline and cell phone metro area, so New York City and Long Island. So these are just some of the findings. I want to just go over top line view of everything. Everyone, as Joe mentioned, has seen these different types of devices. It used to just be Fitbits. It's expanded to Apple Watch, Garmin Watch, Whoops, Auras. We have a couple of samples over there on display. But 44% of respondents are wearing a health monitoring or wearable fitness device. Of the 44% who wear some kind of device, 53% are wearing an Apple Watch, 28% a Fitbit or a similar steps tracker, 25% are wearing a glucose monitor. Dr. Glatt and Dr. Sharma will speak more about that use. And then fewer respondents are using the Oura Ring or the Whoop watch, but those are gaining in popularity. Those are newer devices. Also among those wearing a device, 63% say the device makes them more likely to visit their physician, 24% said less likely, and 74% of device wearers say they share their information with the doctor. And this number actually goes up exponentially of glucose monitor wearers who share their information with doctors. 62% who wear the device say they're wearing it because their doctor recommended that they do so. And you can see from the chart here the percentages. Do you share the information from your health monitoring or wearable fitness device with your doctor? 75%. And this actually breaks down by demographics, New York City versus Long Island. It breaks down some racial demographics. And we'll talk about this in a little bit, but really men under 50 are using the devices more, but they're less likely to either share their information with their doctors or actually make sure that they have annual physicals with their doctor. Hispanics are also less likely to wear the devices and also to schedule regular wellness visits. We also polled about direct-to-consumer products. So people were less familiar with these products, but they are familiar with at-home COVID testing, flu mist, obviously at-home PSA screening. We also talked about the his and her product lines that you see a lot advertised online. So 39% of respondents have used one of these direct-to-consumer products. 57% said they're concerned about data privacy in direct-to-consumer products. But only 36% of those who use these products shared that concern. That always comes up with wearing any kind of trackable device, it's data privacy. 53% say they're more likely to screen for health conditions if they can do it at home. So if you're able to do flu mists at home, you're not going to go to your doctor's office, for example. 1/3 of respondents say a health monitoring or wearable fitness device is on their holiday wish list. And actually, those who have one want a newer one. They're always upgrading the technology, so if you have one, you want a newer one. A couple of other things, as I was mentioning before, 51% of respondents have had an in-person wellness or annual physical in the past year. Good news. 37% have had one in the past 2 years, and for 11%, it's been more than 2 years. And Hispanic respondents and men under 50 are least likely to have had a recent physical in 5 years. And again, this breaks down our demographics about when your last in-person wellness exam was. And you can see men under the age of 50 are the 43% in the past year, which is well below the average. So just some key messages, just part of our public education as we get into the results of the poll. We do want to encourage device users to share their information with the doctor. You spend all this time wearing the devices. Now take the time to share the information. But there's still room to grow, especially among those who use devices other than glucose monitors. We'd like to better connect with our Hispanic communities. They're the least engaged with health and fitness devices, direct-to-consumer products, telemedicine, and annual health and wellness, and again, our men under 50. So I think we'll get started with our panel discussion. I'll kick it off to Joe, and I'll join the panel shortly. Thank you.
Very good. Dr. Sharma, I'm going to start with you. I think you've been encouraged by the poll result that showed almost half of the poll respondents are using some kind of wearable device. From a healthcare provider perspective, why do you think these devices are beneficial?
So there's a number of reasons why they're beneficial. First of all, if the users understand what's going on in their body, they have a better understanding of what they may need to pay attention to. So for instance, if you're exercising, your heart rate jumps to 170, it's probably worth looking into why that's happening. Similarly, if you have diabetes and you're able to do glucose monitoring, you better understand how your blood sugar fluctuates during the day based on your meals, et cetera, and you can share this information with your healthcare provider, who can then make adjustments based on longitudinal data as opposed to spot data, which we get in the office, which is episodic and really just oftentimes the one set of data.
Are there any potential downsides, false positives?
So generally speaking, the devices are fairly accurate. Many of them have now FDA clearance. That's how advanced the technology has become. So they're fairly reliable. I wouldn't discount any of the data that you get from it. What I would say is the data is limited. So as an example, many smartwatches can now do an EKG or ECG, and the Apple Watch, for example, does have FDA clearance for that. But that is a 1-lead EKG, whereas in a doctor's office you would get a 12-lead EKG, which shares a lot more information about the heart. But even that 1-lead EKG can show you if you're having an irregular heartbeat. So let's say you're feeling palpitations, you do the EKG, ECG, and it'll tell you if there's an irregular heart rate and that you may need to seek care. So all of this is just more information about what's happening inside of us that we can now act upon. And the real important thing is to use the data in a meaningful way. So if it's used to guide your exercise, great. If it's used to guide your healthcare, even better. So access to the data is important, but using the data meaningfully is also important.
I'm going to throw it over to Dana.
I know the poll focused a lot on the fitness trackers, but we did also ask about glucose monitors, Dr. Glatt. So they're mostly used for people with type 1 and type 2 diabetes, but many are now prescribed for those who have pre-diabetes. And I think I mentioned I have a friend who wears one and is not pre-diabetic. So just talk a little bit about the glucose monitors and their role in health.
Sure. So there are a number of ways that you can monitor the glucose in a person's body. Classically, we've done that by doing a needle stick. You have to get a little piece of blood and you test it. You can do that with a finger stick. You can do it with a regular blood test. Here we're talking about what we refer to as continuous glucose monitoring, CGM. And this is in a less invasive way. You put some sort of a button on you that can tell from the subcutaneous fluids what your sugar is correlating with in the blood. And this is an extremely useful tool for patients that have diabetes, that are taking medications to treat their diabetes, and it can give the doctor a tremendous amount of information. As Dr. Sharma said, instead of just getting a single point in time, you get a continuous, accurate assessment of how their blood glucose, their blood sugar is doing over a period of time. And then you can see fluctuations based upon what they're eating, based upon their medications, based upon other factors, exercise, sleep, etc. And this can be an extremely useful tool for the doctor, especially one who's experienced in treating patients with diabetes, such as an endocrinologist, but your regular internist does that as well, and can make very useful, good clinical decisions for you. On the other hand, these CGM, continuous glucose monitorings, are available, so to say, over the counter. You can order them yourself, and unfortunately, I think many people feel that this is a very useful way for them to monitor a condition that they don't have, which is diabetes. And to my best knowledge, there is absolutely no data to support a healthy person who's not diabetic, is not needing to have their glucose monitored on such a rigorous basis, to go and take these CGM buttons and monitor their glucose. Now, that's not to say that there's not information that might be there that's important, but there really aren't any scientific studies to suggest that this will improve their health care. Now, some people just want to know, and they're curious as to what happens when they have pizza. What's that going to do to their blood sugar? And if they exercise a lot, what's that going to do to their blood sugar? But for most people, it's normal and expected that you'll have fluctuations in your blood sugar based upon what you're eating, what you're doing. And therefore, again, I caution people to make inaccurate assessments about themselves. Share this data with your doctor if you are doing it, and have your physician guide you as to what the data really mean, because it is normal to have your blood sugar elevated at times, and it's normal to have your blood sugar, quote, lower than normal at times. It's all part of the normal process of body regulation of sugar.
Thank you. Dr. Sharma, we spoke a lot over the past couple of days about the direct-to-consumer products, and the public in the poll was less sure about these products. They didn't really know what they were. So maybe talk to us a little bit about those products and what you see for the future of people testing at home.
Sure, Dana. So direct-to-consumer products run the gamut from at-home testing to at-home screening to virtual healthcare visits that result in prescriptions. So any of those and a few other items also in there, including at-home treatments. So there are a number of treatments that we see, like the flu mist, right, is a nasal vaccine that you can get with the prescription at home, and this way you don't have to go out and get a shot. The good thing is vaccines are available at almost every pharmacy now, so we don't have to make a special visit anywhere other than the pharmacy to get most vaccines, but this is one vaccine that's available at home. And I think 21% of people said they were using the flu mist, of those who use an DTC product. So to see people getting access to flu protection is great. The other products we talked about, COVID testing, so folks want to know if they have an upper respiratory infection, is it COVID or not? It was the number one direct-to-consumer product used by the poll respondents rather, and that's also great information to have, because we know that COVID is still problematic for certain at-risk groups, and if you have that information, you can protect people in your home or your life that might be at risk. So having that information is an extremely powerful tool. Similarly, there's these compounding pharmacies that sell products directly to consumers by getting them a virtual healthcare visit. And then good examples of those are Hims and Hers, where someone wants a hair loss product or whatever, so some of these GLP-1 agonists, Ozempic type drugs, and they have a virtual visit with a provider who then prescribes the drug. I think this is a little more dangerous because it's clearly there's a conflict of interest for the company that's selling you a drug and then also giving you a provider who's prescribing the drug, because they're going to be more likely to prescribe something, and do you really need that? It generates revenue for the company. So I do have concerns with that model. And then the regulations around them are not so great right now. So even the compounding product that you're getting could be highly variable compared to what's an FDA-approved product that is highly regulated. And then finally, we talk about at-home screening, like Cologuard as an example, which also does require prescription. It's a great way, if folks are, whatever we can do to reduce resistance to screening, make it easier, make it more accessible, make it less invasive, these are all great advances.
Let me just switch gears a little bit. When you parse the data, one of the findings was that men under 50 are less likely to share their data as opposed to women. Why do you think that is?
So I think Dr. Glatt and I would both agree that that's a perennial problem, that men under 50 are less likely to seek healthcare for anything. You see, it's almost a stereotype where the wife is dragging the husband in to get care because the husband is kind of ignoring symptoms that are crying out for attention. And I remember one day I was working in the emergency department, and a patient was driven in by his boss who was having a heart attack, and his boss wouldn't let him stay at work. So the gentleman went to work having a heart attack, and his boss had to drive him in. That patient literally dropped dead in the middle of the ED. We were able to rescue that patient. It was a great save. But had his boss not driven him in, he would have dropped dead at work, and it would have been very likely a fatality in a middle-aged man, 40, 48 years old. We tend to ignore symptoms. There's this sense of protracted youth invulnerability that men kind of grapple with, and it's a challenge that we as a healthcare leaders need to work on and continue to educate and continue to promote that. Hopefully these devices will tell you, hey, maybe go see somebody, and hopefully that'll drive more men to seek care.
So that's certainly very true. Anybody who's practiced medicine knows that the woman of the house usually is the one that drives the healthcare appointments, certainly for the children. And again, there's always exceptions to the rule. But usually it is the woman that's bringing in the child for healthcare, and much more frequently the woman bringing in the husband than the husband bringing in the wife or recalcitrant spouse not wanting care. Having said that, younger people tend to be much more immortal in their thinking than older people. And as you get older, you realize that things go wrong and things aren't working as well as they used to, and you're much quicker to seek healthcare, whereas a younger person tends to have a certain sense of invincibility about them. These are generalizations, and they're not meant to be pejorative against any person or group. However, we have to be cognizant of the fact that there are populations in our society that don't seek health care. And that's why these at-home, easy-to-do types of screenings or care can be very, very helpful. There's a downside to that, however, in that it may prevent you from going to your physician. In the past, if you went to your physician for a flu vaccine, so then they might also do a physical exam on you and identify a problem before it's clinically so evident. Again, these are all variables, and you have to weigh the ease of access to a treatment versus getting a more comprehensive evaluation in a physician's office. But certainly for people that do share, as most of them do share the data with their physicians, these home screenings are fantastic. Women can now get home screened for cervical cancer, which is one of the major causes of serious illness in women. You can do your own home testing. Men can do their own prostate testing at home. As was mentioned, you can do GI cancer testing at home. And there are many, many other tests that now can be brought out much more easily, and people can get screened much more easily. But the critical thing is to make sure that there's that connection with the physician's office to make sure that when you do get a result, positive or negative, you let your physician know, and then additional testing may or may not be needed. And also to save you from undergoing more invasive tests that a physician might order, not knowing that you've had these other tests already.
So, Dr. Glatt, to your point, the good news is that 70% of the respondents agree that these products do not replace primary care physicians, and they have confidence in their providers. So, do you think, for both you and Dr. Sharma, that these types of products help engage people more with their physicians, or is it keeping them away because, to your point, they're starting to do some more stuff at home?
So I think the poll did show, as you said, that many patients, when they use these tests, it actually fosters a relationship with a physician, which is ideal. Home blood pressure monitoring is one of the most important things in taking care of a person with high blood pressure, with hypertension. There's the white coat phenomenon. When people go to their doctor once every 3 months and all of a sudden their pressure is off the wall, well, that's because they're terrified of going to the doctor. And if they take their blood pressure at home on a regular basis, gee, it's relatively normal on their blood pressure medications. When they come into the doctor, it looks like they're not responding to their blood pressure medications. So absolutely, there's a lot of room for us to improve upon the way we diagnose and monitor patients with disease. But the critical factor is to make sure it's done under the supervision of a physician.
Yeah, I think you may find your kids at home actually do raise your blood pressure. But this is information, and folks are looking for information about their health, and what we're seeing is they use this information to make decisions about seeking care, and that's great. Because prior to this, everything was unknown, right? The only way you could know what was happening was to see somebody in the office, and then you get spot data. Spot data is helpful, but this longitudinal continuous data is fantastic. Right? So I do think it's encouraging people, it's informing people, it's giving them agency and autonomy, and it's all for the better.
So, Dr. Sharma, I just want to go a little bit deeper on the cardiac front. We were hoping to be joined by Dr. Canner here. We have a terrific cath lab upstairs. They have explained to me as a layperson that there's the plumbing side of the house that deals with the blood flow, and there's the electrical side of the house, which deals with the rhythm of the heart. On these devices, you can actually get a rhythm. So how useful is that? Is it dangerous to have that, be able to track my heart rhythm on my phone? What's the deal?
Certainly not dangerous. I mentioned before, the Apple Watch, as one example, is FDA cleared for that tracing. And that tracing is measuring your rhythm. And folks often will feel unwell, non-specifically, or they'll feel palpitations, and they're not sure what's going on, and it goes away. So by the time you see your doctor, typically that issue is resolved. They now have the ability at home to do a tracing to see if those palpitations are actually an irregular heart rhythm, and that's fantastic. And you mentioned the electrical side of the heart. Dr. Canner, who is our chair of cardiology, is also our chief of electrophysiology. Electrophysiology studies the electrical circuitry of the heart, because so much of what we see in irregular heart rhythms are almost always related to the circuitry of the heart. So being able to do that in that moment is not only is that great information for the user to see if and the watch will tell you if it's irregular or not. It won't tell you what the rhythm is, but it'll tell you irregular versus regular. But also to be able to share that information then with your healthcare provider who can see it and then assess it and make a determination as to what the rhythm is and what further testing needs to be done. I think it's all great information that we should be moving more towards and not away from. I don't think there's any danger to it at all. And I'll tell you, I didn't wear it today, but I have an Apple Watch, and somebody recently in my family was not feeling well, and they felt like they had palpitations. And I put my Apple Watch on them, and I did an ECG. And I looked at the tracing, and it's a fantastic tracing. And Dr. Canner has shared that he's very impressed with the tracings that he's seeing on these wearable devices. So
does that mean that you can replace the monitor?
So no, it's a 1 lead tracing. It's very limited, right? So it will show you 1 out of 12 leads. A Holter will show you at least 3 leads. And the Holter is more continuous, right? In order to do the ECG on these watches, you have to have 2 points of contact, so you can't run it all day. The Holter will run all day. We also use something called an event monitor, which the patient triggers when they feel funny, and it'll then track what's happening with their heart rhythm. But it does not replace those. What it does is it informs the physician with more data to determine whether those are necessary. So let's say you came in with a tracing and it's clearly a fib. I don't think you need a Holter monitor at that point. I think we need to come up with a strategy for making a further diagnosis of atrial fibrillation. But if the rhythm is completely normal, then a Holter might be necessary, as an example.
Can the devices then interfere, let's say, with an implantable device like a pacemaker?
No, they should not interfere with anything that a medical device, which are typically shielded and have certain safeguards in them. These are very, very limited devices. The only thing I would say is if you have an implantable device, there are certain restrictions on what you can't go through certain magnetometers and things like that. But other than that, no.
So just to add on to what Dr. Sharma said, the advantage of something that you're wearing 24/7 for years is that when a person has an occasional symptom, even if you do a week of Holter monitoring, 2 weeks of Holter monitoring, you may not pick up an occasional irregular type of a abnormality. Whereas these types of devices, gee, I suddenly feel a little lightheaded. You can do the instantaneous, and this is a very useful tool. When the Holter monitor is done, so they tell you if you feel symptoms, press a button so we'll know exactly when you have the symptoms and we can correlate it. But symptoms may not show up in even a week or two of monitoring for those irregular or occasional types of abnormalities, which can be critical. So that's, I think, one of the major advantages of having something that you can control and say, gee, I don't feel well right now. Let's see what it shows. And this may be for somebody that has this only once or twice a year.
So the one downfall is these types of devices are not cheap. The Apple Watch, an older model during Black Friday, I think was maybe $160. I saw one, I don't know how much are the rings, $300 for the Oura Ring. The Whoops are closer to $300 as well. So again, in some of our underserved communities, we are showing a gap. So I know there are programs out there. There's pilot programs. There's some community screening programs to help make sure everyone can have access to at least a Fitbit or some kind of tracking advice. So this holiday season, anyone have a fitness tracker on their holiday wish list? Are we buying any for anybody? I mentioned I bought my husband a Whoop last year, and he said, I'm not wearing this because it doesn't tell time. But I might try again. I might try it again this year. So anyone else?
I think we're getting, for being on the panel today, we've been told that we're going to get these. So again, it's a choice. I think for somebody at risk for any of the things we're talking about, it's very, very useful. For your typical relatively young, healthy person who doesn't have any specific indication for some of these, it's much more optional than if you have a parent who's reached the age where they occasionally have some symptoms. Wow, this is a great tool and a nice gift, especially if it tells time too. So I think that this is up there on the wish list for some people, and how high it should be on the wish list will depend on numerous variables, your financial status and ability, but also the real need for it. I wouldn't tell anybody to, not eat supper so they could buy one of these CGMs if it's not medically indicated. So use judgment, as with most things in life. Use judgment.
And the cost is also somewhat reflective of the technology that's in these devices, and over time this will come down in price. So it's just a function of time for some of that. And for heart rate monitoring, as an example, while you can't get continuous monitoring, they do sell sensors that work with the phone. So if you have a smartphone, you can get and you're worried about, let's say, palpitations, as an example, you can get these sensors, and they're under $100, so they're relatively less expensive than these wearable devices. So I think there are options available for specific issues if folks are having challenges with the price point.
So one issue that we haven't covered, some people are worried about Big Brother. Apple is now going to have all my health data. Is this a serious concern? And before I let you answer that, we do have a member of the press here. I want to leave some time in case you have any questions.
Yeah, unfortunately, we live in a world where all of our information is everywhere, and the sense of having data security is a fallacy, right? There is no such thing as data security, unfortunately. I don't think you should be deterred by learning more about what's happening to you because you're worried that Amazon or Apple or somebody's going to have that information. They do have in their agreement terms what is and what isn't shared. So if that's important, you can get the level of detail. I think most folks have resigned themselves to the fact that we live in a free data society. So.
Yeah, I agree 100%. I would not worry about these things if there was something that was important. I'd be much more worried about all sorts of other potential scams for getting your data as opposed to getting it from an Apple Watch.
Any questions?
I mean, the data security one was my big one I was going to ask, so great work getting it done. Another one I wanted to ask, and I understand that this didn't come up in the survey, but was there any reason given by respondents why they might be wearing a wearable but not necessarily sharing that data or that information they get with the doctor?
Well, there wasn't any specific on that. What we saw, you saw by the age trend, the only one data point was that the men under 50 didn't seek care. So I think it was more, not that they're not sharing it, that they're just not having a visit. So it's reflective of maybe healthcare utilization versus data privacy or data sharing concerns. What we saw if you have the slide with the women, it was almost equal in terms of the distribution for men and women under 50. Women under 50 and women above 50, it's 95 and 96%. So you can see that from that perspective, that gender has no issues with sharing data and acting upon the data. So I do believe it's probably buried in there, but we didn't ask that specific question.
I think there are very few people that if their doctor asked them for that information, they wouldn't provide it. No, I'm not sharing that with you. I think, as Dr. Sharma said, it's where would this ability to share it occur? If you're not seeing your doctor, you're not sharing that data. If you are seeing your doctor, if the doctor were to ask for it, I'm sure the patient would provide it. The patients sometimes don't even realize that the doctor might find that important, or they may be embarrassed to say, well, I've been monitoring myself, and they may not provide that information. So I don't think it's a concern that the patients don't want to share it with the doctor because of the privacy concerns. I think the opportunity to share it probably isn't there, and especially for the groups that aren't seeing their physician.
Just one other thing I wanted to mention. I guess since insurance is not covering devices, I thought it was interesting that Jamie Wearable said she was able to purchase Aura with FlexPay. But they didn't question what was this for, as they usually do with me.
Yeah, well, that's interesting because unlike the watches, the Aura serves only one function. So it is a healthcare monitoring device, right? And you can easily see the healthcare benefits of monitoring your health that way. And because it's a limited function device, it must be eligible for the flexible spending accounts, the healthcare flexible spending accounts that many employers have set up through the federal programs. So I do think that's also interesting. And if folks have access to that, certainly it's something they could consider using those dollars on. But we're not at the point where the watches are covered by flexible spending yet.
And just correct one misconception maybe. If it's by a physician, not the Apple Watch or the Aura, but the continuous glucose monitoring, the Cologuard, the other medically indicated procedures from a physician, those very well may be covered by insurance, depending on what insurance you have and deductibles and things like that. So just we have to differentiate between self-driven, I think this is a good idea, versus physician-driven, this is what I'm prescribing for you.
Okay, if there are no more questions, thank you for joining the panel today. Unfortunately, Dr. Counter wasn't able to join, but we will get him later on for some follow-up video. Thank you.